Hi, in today's section, we will be looking at a group of drugs commonly used in our own healthcare system. It's one of the essential drugs. Sulfonamide groups of drugs. Sulfonamides are often referred to as sulfur drugs. They represent a class of antimicrobial agents, that is, agents that are against microbes. Sulfonamides were among the first effective treatment options for many bacterial infections. They are mostly synthetic compounds that contains a sulfonamide group, which is characterized by a sulfonyl functional group and also attached to an amine group. Look at the amine group. Let's briefly look at the history part of these drugs. The discovery of sulfonamide dates back to 1930s. One of the notable form of this drug then was frontosale. It is worthy of note that when the sulfur drugs was brought into the healthcare system, it actually revolutionized the treatment of bacterial infections before the widespread of penicillin group of antibiotics. Because when it was introduced, it really helped in reducing the number of deaths caused by bacterial diseases, including streptococcal infections and pneumonia. Mechanism of action. How do this group of antibiotics work? Sulfonamides exert their antibacterial effect primarily by inhibiting the synthesis of folate. Folate is a vitamin that is important for the growth, reproduction, and metabolic functions of bacteria. All bacteria grow, live, and do whatever they are able to do with the help of folate, a vitamin. So when you derive these bacteria, this folate, they actually would not survive or multiply because folate help them to grow, help them to reproduce in their numbers, and also help them to do metabolic functions such as digestion, conversion of whatever enzyme that they make use of. How do sulfonamides do this? The sulfonamide group of drugs accomplish this task of destroying the bacteria by competing with these bacteria. This competition occurs at the para-aminobenzoic acid, which is a substance for the synthesis of the hydrotolate, which is essential for the synthesis of folate. So to put it up, sulfonamides inhibit the synthesis of that enzyme. Sulfonamide drugs inhibit the synthesis of that enzyme known as dihydrotorate synthase. Dihydrotorate synthase. As such, once this enzyme is being inhibited or being prevented from forming in a bacteria, there would not be any other production of folates. As such, the bacteria would now lack folates, and folate is necessary for the synthesis of nucleic acid in a bacteria. So the sulfonamide group of drugs, septrin and all of that, they do this work by inhibiting the production of this enzyme. And this enzyme, dihydrotorate, is very, very important for the production of folate. And folate is very important for the production of nucleic acid synthesis in a bacteria. Without the production of this nucleic acid synthesis, bacteria cannot grow, bacteria cannot reproduce, bacteria cannot carry out other metabolic functions. Remember, the nucleus is the control of every cell. So prevention of the release of this synthesis of this dihydrotorate synthase leads to the lack of production of folates, and lack of production of folates affects the production and synthesis of nucleic acid. And this happens in the following ways. Summarizing the mechanism of action of sulfonamides: 1, it competes. It competes. 2, sulfonamides inhibit the conversion of para-amino benzoic acid, PABA. It inhibits the conversion of para-amino benzoic acid to folate because it blocks the production of nucleotides necessary for the DNA and RNA synthesis. As a result of this blocking of these para-amino benzoic acid from being converted to folate, sulfonamides leads to bacteriostatic effect, which means that they inhibit, that is, they stop, they control, they prevent the growth and replication of bacteria rather than killing them. So sulfonamides do not actually kill bacteria. They stop the growth, they stop the replication. It prevents them from replicating themselves in the body. And this is achieved by inhibiting the conversion of para-amino benzoic acid. So this is how sulfonamides achieve bacteriostatic effects and stop the spread of bacterial infections. Let's take it again. Sulfonamides exert their antibacterial effect primarily by inhibiting the synthesis of folate. And you know that folate is a vitamin that is crucial for the growth, reproduction, and metabolic function of bacteria. How do sulfonamides achieve this? They do this by competing with para-aminobenzoic acid, which is a substance necessary for the synthesis of the hydroterate synthase. And the hydroterate synthase is the substance that would now lead to actual production of folates. You see, so primarily, sulfonamides act by competing with para-aminobenzoic acid, which is a substance that is necessary for the production of the hydroterate synthase, which is very necessary for the production of folates. Clinical use. Sulfonamides, like we know, include septrin or cotrimazole and the class. They are one of the commonly used essential drugs in our country, Nigeria. Sulfonamides have a long record of successful use in the treatment of wide range of both gram-positive and gram-negative bacterial infections. They are very much active against some of the less frequently encountered infections, such as leprosy, malaria, toxoplasmosis, and narcolepsy. So it can be used in these conditions. You can use it in malaria because since it prevents the synthesis of folate necessary for these microorganisms or bacteria to grow. Also, one thing you also should know about sulfonamide is that sulfonamide group of drugs also competes for sites on plasma proteins that are responsible for binding of bilirubin. So what this means by implication is that taking of sulfonamides when a woman is pregnant or to a baby who is mostly pregnant, especially during the last 2 months of pregnancy, it means that septrin or any other sulfonamide drugs will now go and bind with the protein, that is the albumin, plasma proteins, especially albumin, that is responsible for clearing bilirubin from the circulation to the liver for conjugation. So this septrin or these sulfonamide-based drugs will go and now be binding on those sites that ordinarily that bilirubin should bind, and so that from that they can be clear from circulation. So when the septrin binds on all of this, then there will be less or little protein left for bilirubin to bind and be cleared from the circulation of a baby. As such, there will be a lot of unbounded bilirubin, which the body can now deposit in the basal ganglia and subthalamic nuclei, which causes kernicterus. And kernicterus is a very toxic brain pathology, also known as encephalopathy. So therefore, clinical-wise, sulfonamide drugs should not be given to newborns or to women during the last 2 months of pregnancy. You don't give it. So this is the sole reason. Because once they're in the circulation there, they will now be bound with most of the protein albumin. You know that the body of a baby transiting from fetal hemoglobin to adult hemoglobin and every other process that could lead to hemolysis will be on the rise. As such, the plasma-bound proteins are active to take away the bilirubin for conjugation by the liver and being excreted through the alimentary canal. But because the septrin is there, or any of the sulfonamide-based drugs are there in the circulation, there will not be much available proteins that should be able to carry these bilirubin for conjugation. It's also worthy of note to say that sulfonamides have what we know as broad spectrum of antibacterial activity. It means they have effect, they have their bacteriostatic effect on various gram-positive and some gram-negative bacteria. For example, Streptococcus pneumoniae, the one that causes pneumonia and meningitis, Staphylococcus aureus, including some strains of mectacin-sensitive strains, Escherichia coli, that cause urinary tract infections, Salmonella, and Shigella species. So septrin actually works much against them. So let's look at side effects of sulfonamide-based drugs. It can lead to allergic reactions. Some patients may develop skin rashes, urticaria, or in severe case, like you can see here, in severe case, the person can develop Stevens-Johnson syndrome, also known as toxic epidermal necrolysis. See what is happening here. There's a lot of necrosis, that dead tissues. This is a form of the allergic reaction, Stevens-Johnson syndrome, or toxic epidermal necrolysis. So that is one of the side effects of sulfonamide-based drugs. And this Stevens-Johnson presents with fever, malaise, erythema multiforme, and ulceration of mucous membrane of the mouth and genitalia. Also, septrin can also lead to hemolytic anemia in persons with G6PD, that is glucose 6-phosphate dehydrogenase deficiency, which is an enzymopathic disease, which we have dealt in one of the sections. When we look at a certain deficiency. So these are one of the side effects. It can also lead to hematologic effects, such as that's effect on the blood. So that's hemolytic anemia, like we said, G6PD, yes, as hematologic effect. It can also lead to agranulocytosis, or also known as aplastic anemia. Then it can also lead to mild symptoms such as nausea and vomiting, diarrhea. It can lead to diarrhea, nausea, and vomiting. So in this type of diarrhea, we call it drug-induced diarrhea. It can also lead to nausea and vomiting. Then in the kidney, it can also lead to what is known as crystalluria, which can lead to damage of the kidney, where there's crystal formation, if the person is not well hydrated. However, in recent times, it's good to understand that resistance to this drug has emerged because the bacteria have now mutations in their dehydroproteinase synthase enzyme, so that even sulfonamides can no longer effectively inhibit it. So bacteria have been able to change that substrate that necessary for folate synthesis. Without folate, it can't exist. So they have found a way to now be bypassing. That is known as mutation. Also, some bacteria also have increased their ability to produce para-aminobenzoic acid, which we know is very necessary for the production of the substrate. So they have increased the ability to produce it much faster than even sulfur-based drugs cannot effectively stop them. So also, some have also developed what's known as efflux pumps, which helps them to expel sulfonamides from the cell before they can exert their action. So even when you take the sulfonamides, these bacteria have developed what's known as efflux pumps, which can push the molecules of the sulfonamide drugs out of the cell before they begin to function in the cell. So that is it. So let's take one example of sulfur-based drug in the essential drug list. Tryptophan. Tryptophan exhibits broad spectrum activity. It is most commonly used in combination with sulfametazole and is active against most gram-positive and gram-negative organisms, especially the Ectorobacteria. There is little activity. Records or data or scientific research proves that there is little activity against anaerobic bacteria such as P. aeruginosa and Enterococci. That means it cannot really function well in prevention of diseases that are caused by P. aeruginosa and Enterococci. Clinical use of tryptophan and sulfametazole, also abbreviated as TMP-SMS. So the brand name of these drugs is Septrin or Bactrin. This drug is used in the treatment of genitourinary disease, that diseases that affect the genitals and the urinary tract, the gastrointestinal, and respiratory tract infections caused by any of those organisms we mentioned earlier, such as Escherichia coli. Escherichia coli can cause genitourinary diseases. Escherichia coli can also cause this organism, Escherichia coli, can cause urinary tract infection. It can cause gastrointestinal infections. It can also cause genital infections. Once it leaves the enterics to any of these, it can cause this infection. So Septrin works best on them. Then Enterococci. Any disease that's caused by Enterococci, actually these drugs will take care of it. Then P. mirabilis and some other positive strains of Proteus species. Then these are Klebsiella pneumonia, which causes pneumonia. This drug can actually work on it. This drug is present in vaginal secretion in high levels. As such, it can be used to treat vaginal infections that are susceptible to the drug among men of childbearing age. It can also be used as a long-term chemoprophylaxis. The drug is also used in infections that caused by resistant Shigella species. Those Shigella species that is highly resistant to ampicillin can be treated effectively with tryptophan. Can also be used to treat traveler's diarrhea caused by E. coli. Because tryptophan accumulates in the prostate, it's also used to treat prostatitis. Then otitis media in children and purulent exacerbation of chronic bronchitis also responds well to this drug because of its activity against both susceptible Streptococcus pneumonia and Haemophilus influenza type B. Also, gonorrhea, typhoid fever, and brucellosis have been treated with this drug Very well. What are the adverse effects of this drug? Serious adverse effects are rare, but can be found in patients who are HIV, who are AIDS, sorry, already having AIDS. So this drug can also cause any of the side effects that's associated with any sulfur-based drugs, sulfonamide-based drugs, such as Stevens-Johnson syndrome, skin rashes, central nervous system disturbances, blood dyscrasis, hepatotoxicity can be toxic to the liver. Okay, but then when given to patients who are HIV, usually present with rash. So because both trimethoprim, septrin, and all sulfonamide-based drugs, they interfere with folic acid metabolism. Their use during pregnancy is contraindicated. That is not advised to use when there is. So therefore, you can't use them when a woman is pregnant, because it can lead to development of what is known as neural tube defect. Neural tube defect, which scientifically research has proven that neural tube defects occurs due to folate deficiencies. And this folate is a vitamin necessary. So even bacteria need it, human beings need it. So when you take this drug to fight by bacteria, yes, it goes and stops the folate synthesis. Also, it can lead to folate inhibition in a fetus. So the use of trimethoprim is contraindicated in patients with blood dyscrasis or who has hepatic damage, that is, whom their liver has been damaged for whatever reason, such as cirrhosis and all of that, or who have renal impairments. So in this section, we've been able to look at sulfonamide-based drugs. We're able to look at trimethoprim and Bactrim. In the next section, we shall look at another essential drugs used in primary healthcare facility, look at them and discuss. Thank you for joining.